Today I'm speaking with Dr. Russell Barkley. Our conversation is all about attention and focus, but not in the way you might be expecting. This conversation is not about those who have the superpower to grind and hustle. Instead, I want to discuss a more honest topic: ADHD. A few years ago, I was on YouTube and saw a recommended video with over 1 million views titled, "This is how you treat ADHD based off science." It was a lecture by Dr. Russell Barkley. Everything he said made a lot of sense. While he was clear that no, not everybody has ADHD, and it does get misdiagnosed, those who do suffer are suffering every single day and deserve help. Dr. Barkley is a clinical professor of psychiatry at the Virginia Commonwealth University Medical Center. He is board certified in 3 specialties: clinical psychology, clinical child and adolescent psychology, and clinical neuropsychology. He has published 25 books and more than 300 scientific articles on ADHD and related disorders. He has presented more than 800 invited lectures in more than 30 countries. He has also appeared on major programs including 60 Minutes, The Today Show, Good Morning America, CBS, CNN, and many others. Finally, to celebrate the new show, I'm giving away a PlayStation 5 to one of my viewers. All you have to do is like and subscribe. That's it. Details in the comments.
It's not real. It's not legitimate. There's nothing there. And what is there is a result of simply, poor training and poor choices. And you can change all of that. And that is completely fallacious. We have hundreds of thousands of research papers going all the way back to 1775 in the medical literature, attesting to the validity and existence of ADHD and the fact that it truly is a neurodevelopmental, brain-based and largely genetic, though not entirely, disorder. I mean, ADHD is one of the top 3 genetically influenced psychiatric disorders we know of, rivaled only by autism and bipolar disorder. And nobody thinks those are life choices anymore, which is a good thing. We used to think that autism was due to bad mothers who didn't love their children. And now, here we are 70 years later, and we've moved past that. But ADHD is still kind of back where autism used to be, being viewed as a result of something in the environment that could be changed and you could get over this. So there's another myth about ADHD we can talk about if you like, and that is, of course, that ADHD is some kind of a gift. So it acknowledges that it's a neurodevelopmental condition, but that it comes with an upside, not just a downside. And I encounter that one as well. Would you like to talk about that?
Absolutely, because I've seen multiple popular YouTube videos that do say ADHD is how you become a startup investor or a CEO. So what are your thoughts on the reality of that?
Well, I want to make it clear that I'm not saying that people with ADHD cannot be extraordinarily successful people. Some of them are. It's rare, but some of them are. And so if we look at Michael Phelps, who's raging ADHD, but still the most decorated Olympian in history, if we look at Richard Branson, if we look at Simone Biles, the Olympic gymnast, or we look over at rock music, at Adam Levine and Justin Timberlake, or we go into athletics and we could identify countless professional athletes. Yes, you can succeed with this, although if you look very closely at their lives, you will see that even they struggle when they, like Michael outside the pool, has a lot of difficulty with self-control and, has gotten himself into trouble because of that. And the same, also DUIs, just like Ty Pennington and others will tell you that, it may not interfere with this non-traditional career they've chosen to excel in, but if you look outside their life at the ability to simply handle the scut work of daily living, it has an adverse effect there. So again, let's make it clear: you can succeed with this, but those are the exceptions to the rule. And most of the people that we see are going to struggle, particularly in the traditional pathways to success through school, education, college, and so on, are going to struggle to succeed through that route. And so, it's not something that blesses you with unique abilities that typical people don't have. I can tell you, in more than 300,000 research papers, never have we seen ADHD convey a attribute to somebody that was better than the control group, in no
Wow.
way. So, we have to get rid of this idea that it comes with these extra gifts. Instead, we have to look at it as you can succeed in spite of your ADHD, your musical ability, your artistic ability, the fact that you're a great, salesperson and drug rep, let's say, have nothing to do with being ADHD. You probably would have been good at those things anyway. But you can succeed in spite of your ADHD. So it's not a gift. And I know some people say, oh, but it leads to more. You can be more creative. People with ADHD have higher levels of creativity. Well, no, they don't. And we've studied that. They're no more creative than anybody else. The only exception is very, very bright individuals who are college educated who have ADHD. So we're talking about a very, very narrow slice, kind of like 1 in 20 people with ADHD are a little more creative than other people around them in terms of coming up with more ideas and more diverse ideas when they're faced with a particular, say, demand for a product or an invention. They come up with them. But here's the downside. That research also shows that while they may come up with more ideas and more far-fetched ideas, some of which are very valuable, the fact is they're much less likely to follow through on them. The ideas they come up with are much less practical to actually carry out. So I guess if you were working in a team, say in a marketing research company, and you worked with a small group of people, and they did the follow through and the practical evaluation of your ideas, you could contribute to that team very nicely. But notice I'm talking about a very, very narrow slice of the adult ADHD population. The rest of adults with ADHD are no better or no worse than anybody else when it comes to creativity. But I think it misleads people into devaluing ADHD as a serious disorder when they hear about these gifts and this creativity and isn't ADHD wonderful? Well, I tell you, you keep talking like that and you're going to lose all the entitlements that we have spent 30 years trying to get for people with ADHD through Social Security, through Americans with Disabilities Act, through the educational, special education laws. We work very hard to get services for people. So don't go running down the halls of Congress screaming about how wonderful ADHD is, because why then would we do these things for you?
It kind of sounds like when you were talking, I was thinking it's very easy to dismiss ADHD from an almost survivorship bias perspective, meaning that person doesn't have ADHD. I struggle with my attention. I have to turn my phone off. And I figured it out. So that survivorship bias seems like that might be contributing to the virality of some of these articles that are ranking incredibly high on Google, which is leading to a lot of really weird misinformation. But I wanted to ask you, and you kind of covered this, is ADHD completely genetic, or can a childhood experience, a brain injury, your social media activity, your diet, your sleep quality, are there a bunch of factors, or this is a genetic conversation?
Well, let's sort through it. There are multiple causes to ADHD. Okay. But that said, the vast majority of them fall within the realm of neurology, the brain and how it develops, and related to that, genetics, because it takes proper genes to build and operate a proper brain. And so to oversimplify for the sake of discussion, about 2/3 of ADHD is genetic. It runs in families, or it arises from what we call de novo or brand new mutations in that child that do not exist in the parent's own DNA except in their eggs and sperm. So these are new mutations that have come up, and they arise as a result of people waiting to have children. So current generations are waiting at least a decade longer than earlier generations to start to have children. You now have 8 times more mutation in your eggs and sperm than you had when you were 20 if you wait until
Wow.
you're 30. And so about 10% of ADHD we think is arising from this pattern of the population waiting and accumulating mutations. And the genes for ADHD, like the genes for autism, are the most sensitive to mutation because they're the latest to arise in human evolution, and so they're still not very stable. But it runs in families strikingly. If you're an adult with ADHD, half of your children are going to have this disorder if it's of the genetic form.
Wow.
If you have a sibling with ADHD, which I do, the risk, or I did, he passed away as a result of his ADHD, but that's 35% of the siblings of kids with ADHD have the same condition. And if you're an identical twin, it goes up to be about 75 to 80% shared risk. Now, what that tells you is that there's a small amount of ADHD, about 30 to 35%, that doesn't arise from genetics. It arises largely from pregnancy complications that interfere with the development of the brain. And those could be drinking alcohol during pregnancy, multiple infections during pregnancy, or mothers having, diabetes during pregnancy, gestational diabetes. It could also come from premature birth that leads you to be put in a neonatal intensive care unit. 45% of children who go into those intensive care units will have ADHD by the time
Wow.
they're 5 years of age. And then after birth, you mentioned one, traumatic brain injuries are known to increase risk for ADHD. And the more you have, the more likely you're going to get an acquired case of that. Lead poisoning would be another one that could lead to that. And then, of course, severe deprivation, which we saw in Romanian orphans being adopted out of Romania back after the fall of the country in the 1980s. And these were severely malnourished and deprived children in these orphanages. Many of them came out with some of the worst ADHD that we've ever seen. But I want you to notice every cause I've mentioned has a biological impact on the brain's development and functioning. And that's why we say without doubt that ADHD is neurodevelopmental. It is not due to screen time and to your diet or to sugar or to simply, as you pointed out, not getting enough sleep or some kind of life choice. Those things won't help, but they're not the origin of the disorder.
So, as the trend has gone to have children much older in North America for sure, are you getting concerned about this? Because it seems like that's going to lead to a lot of ADHD children.
Well, I think the rise has already happened. I
Oh,
mean, this
wow.
has been going on now for at least one, if not two generations. A case in point, I waited till I was 30, as did my wife, to have our sons. Both of them waited till they were in their 30s. And now you've got 64 times more mutations
Wow.
racking up across those two generations in the very genes related to autism and ADHD and intellectual disability. So yeah, we have seen a slight rise, particularly in autism, because about 1 in 4 cases of autism is due to those genetic mutations. It's about 1 in 10 for ADHD. But the fact is, there's been a slight rise. Most of the rise that's been going on, however, is not so much in true prevalence, that is, a higher number of cases than before. It's in greater public awareness that leads to being referred and diagnosed. So better identification leads to better recognition and diagnosis and leads to more treatment. And so that's a good thing. That means that we're reaching more of the population that had the disorder and trying to get them to be referred and be treated for it. But there is some evidence of in various parts of the world, slight rises and falls in prevalence based upon the extent to which these other biological hazards may be surrounding you.
When you were talking about brain injury there, I've been thinking about this conversation that's been happening in Canada recently, and I'm sure it's happening in the US as well, around parents putting their kids into high impact sports, whether it's football or hockey at a young age, because of this risk of CTE. A lot of people are talking about. Is ADHD also something you should be concerned about if you're putting your kid into football or hockey or whatever it is?
Yes,
Oh, wow.
there is an acquired syndrome that first of all deals with inattentiveness and poor working memory that can come from repeated closed head trauma, whether it's through extreme sports or football or boxing or soccer. Anytime that your head is being hit repeatedly, you're getting small injuries. It doesn't have to be full concussion, although that can do it. But here's the rub. There's an interaction going on here. Kids with ADHD are more likely to enter sports, probably because it's a better pathway for them to find success than academics. Kids with ADHD are therefore more likely to experience traumatic brain injuries, and some of that comes from their extra risk-taking. They're willing to try things other people don't, and sometimes it doesn't turn out well for them. And then what happens is those injuries then feed back to worsen the initial ADHD that they had when they came into the sport. So, you can have this interaction going on, but we've also shown that even in cases that had no pre-existing ADHD, repeated TBI is linked to a marked increase in risk for ADHD downstream from there. And by the way, it doesn't have to happen right away. Some of the studies show that it can occur within 9 months to 5 years following a significant traumatic brain injury. So, you really do need to be careful about these things. It's not just going to be a problem with forgetfulness and working memory and inattention. Those go with ADHD too, but it could also lead to a fuller acquired form of an ADHD syndrome.
One of the things that kind of surprised me as I was doing research for this, looking at the symptoms and the forums and what people say ADHD feels like, is how similar adult ADHD, anxiety, and depression symptoms felt, at least. Do those get misdiagnosed? Or if you have ADHD, you're going to be anxious, and if you're anxious, you might be depressed. What is the similarities with mental health concerns like depression and anxiety?
Well, there's no real similarity across those three disorders. They're very easy to diagnose when you see them independent of each other. So when we see pure cases, which is not very often, but when we see a pure case of ADHD or depression or anxiety, those aren't confused with each other. Now, what can make it confused if you have a particularly uninformed clinician is all of them interfere with attention. And so if you think that ADHD is only inattentiveness, then you're going to rush to decide that because there's inattention across these disorders, then this is ADHD, or this is depression, or this is anxiety. But if you understand ADHD as I've explained it to you, first of all, you're going to learn a couple of things. ADHD predisposes you to anxiety over time. The longer your disorder goes untreated, the greater the risk for an anxiety disorder. So for instance, kids with ADHD, about 15 to 20% have an anxiety disorder. That figure, by the time you're in your 30s to 40s, is 45%. It's more than doubled. The same with depression. It's somewhat low in children, maybe 10 to 15%, if that. Starts to rise by high school when it reaches its peak, and that's when suicidality becomes a major concern of ours, and then gradually declines over time, but remains this kind of low level, what we call dysthymia, which is mild depression, along with just feeling demoralized about your life because you can't seem to accomplish all the goals you set for yourself the way other people are able to do. So a lot of adults with ADHD that we see come in with all three of these at one time or another. And rather than try to sort them out as to, you only have one, we really look at what we call comorbidity, which is common. Disorders coexist together, and you're going to need to treat all of that. Now, what helps you as a clinician is that ADHD appears earlier than those other disorders. So history can tell you which one of these was the chicken and what are the eggs that are racking up here by way of anxiety and depression. The second thing is that expert clinicians know that the kind of inattentiveness ADHD produces is linked with disinhibition, with impulsivity, with distractibility, with being overly governed by all the things around you and not being able to regulate your behavior by your goals, your thoughts, and these mental representations representations we all hold in our frontal lobe here that have to do with goals and things that we need to accomplish and the steps that we're trying to use to get there. It's called working memory is what I'm talking about here. And it's what you lose when you reach my age, which is why you can go outside to get the mail and never get it because you're pulling weeds and reading the paper and talking to neighbors. You forgot why you went out there, but also the environment has now captured your behavior. And so that's the nature of the inattentiveness in ADHD. The environment is too strong. Mental representations are too weak in working memory, and therefore you're not able to follow through. Anxiety and depression, on the other hand, produce quite the opposite pattern of attention. These disorders decouple you from the environment, leading to preoccupation with mental content, ruminating, thinking about problems, what your fears are, what went wrong, are those people judging me in this social situation, how could I have done that, and even catastrophizing a bit. So there's a bit of daydreamy, spacey, mind-wandering, confusing, and even rumination going on in these disorders. So the person with depression and anxiety is not available to the environment. They're missing a lot of what's going on around them because they're in their head way too much more than other people are. And that's not true for people with ADHD. Now, if you happen to have both of these disorders, guess what? You're going to do both, right? You're going to be very distracted and not able to accomplish things. And if you have a few moments, then you're going to get inside your head and start to feel bad, usually after the fact. So I hope that helps people to understand that if you really know these disorders, they're relatively easy to diagnose properly. But if you're not well trained, you could start to confuse some of the symptoms with the other. But at its core, ADHD is a disorder of inhibition and self-control, and depression and anxiety are not.
When you think about emotional regulation, and as you were talking about executive functions and the ability to regulate your emotion and impulses, I just thought about in my personal life, in my business life, there's a lot of days where I'm a little bit frustrated with my manager. I'm a little angry with my record label. I'm not happy because something wasn't scheduled right. And if I wasn't able to resist the impulse to pick up the phone and start yelling, if I wasn't able to resist the impulse to send a big email to 10 people on an email chain, I would be in a really, really tough position. And I think about the person with ADHD working in a office somewhere. It seems virtually impossible. And it must make their financial and personal lives just incredibly unbearable at times.
Well, it does, Peter, and I'm glad you brought that up because this is only a relatively recently recognized component or aspect of ADHD. We can go back 10 years to when the first reviews and papers were beginning to look at this and begin to argue, as I did, that emotion regulation is a central feature of people with ADHD. It goes with the disinhibition and the inattention, and it's not in our diagnostic criteria. It's not in the trade books the way they're written to think about ADHD, but it's there. It's there in spades, and we were able to show through a number of research studies, including a follow-up study I did for 25 years in Wisconsin, but other people were able to replicate this, that not only is this a central feature, but the emotional problems, as you've pointed out, predict certain downstream impairments and problems in your life that are not related to the inattentiveness or the hyperactivity or the traditional symptoms. So if you didn't think about emotion being part of ADHD, you wouldn't understand why they're having these problems. Let me just list a few of these. The emotion regulation piece of ADHD is the single best predictor of how many friends you will have in your life. From childhood onward, there is no better predictor. People can put up with your distractibility and your fizziness and your talkativeness, but if you react emotionally very quickly, if you're impatient and frustrated and hostile, or react with what we call reactive aggression, or you're just overly silly and emotional and easily aroused in situations, people are going to say, hold on a second here, I don't have to put up with this stuff. I'm not your punching bag emotionally just because you want to let off some steam quickly here. So, friendships are a major problem because of this reacting. And you can imagine if you're on social media, even normal people, typical people, get into what we call flaming, which is because it's an anonymous, Twitter or tweet or, Facebook post or Instagram, you say things you are going to live to regret because you're not in a face-to-face encounter that would dampen down this propensity to flame, and get emotional. And we find people with ADHD pay a severe price on social media because they just react impulsively to these provocations and the trolling that's going on and, the posts of other people they may not agree with. But it's not just in social media. When we look at their work life and at their dating life, for instance, ADHD is the best predictor of intimate partner violence in a dating relationship. Because let's face it, there's nothing more emotionally exciting, arousing, and frustrating than being in an intimate relationship with somebody. And you have to be able to negotiate those kinds of differences of opinion and disagreements. And people with ADHD can overreact in those situations very quickly. And then, as you mentioned, we showed that it was the single best predictor of being fired from a job. More than anything else, and people with ADHD get fired at least 3 to 4 times more often than other people. And the best predictor of that in our follow-up study was the emotion piece. Employers will not put up with that when you react to customers or your colleagues or your boss, for that matter, by this sort of flaming emotional reaction. So, I can go on. It predicts impulse buying and overspending on credit, and road rage with a motor vehicle are all related to the emotion piece. So, Peter, I'm really glad you brought that up because that's a very under-recognized aspect.
When I've always found, like, in business, one of the best compliments someone could give someone when you're referring them is they're level-headed. And when someone says they're level-headed, they're not going to send you a crazy email in the middle of the night. They're not going to freak out if things are bad for a week or two. And without the ability, and I just reflect in my own life, the people that I thought weren't level-headed probably were struggling, and I couldn't really see past that. So it's very it's kind of scary. But I want to talk about the medication, because I've listened to your lectures, and you promote ADHD medication based on science, and you prove how effective it's been. The one thing that I do see a lot online, and I've even heard in my real life, is how villainized the addictive nature of some ADHD medications like Adderall have become, whether it's a study drug or whether it's people getting hooked on Adderall. So is it justified to say, hey, this is a really scary addictive thing that we need to be careful with? Because that's kind of a huge fear. If somebody I know has ADHD, I almost say, uh-oh, I don't want you to become addicted to a drug, and then you're too far gone. So how do you feel about Adderall?
It's probably one of the biggest misconceptions, Peter, online
Yeah.
and elsewhere, including with parents who bring kids into our clinics and young adults who come to see us. And it's right to be concerned about it, but that largely stems from the fact that the trade media for decades has grossly sensationalized and overplayed the risks related to medication. It sells newspapers. It's great clickbait, when you talk about this, but it's so grossly exaggerated. Now, there is the potential for addiction from these medications if they're taken inappropriately. What do I mean by that? If you crush them and inject them like you would, say, heroin, or if you crush them and snort them like you would cocaine, then yes, they act exactly the way that cocaine would act in the brain, because it's getting into the brain very rapidly, into the addictive reward centers of the brain, and that's what determines the addiction. But if you use these drugs the way we prescribe them, where you take them orally and they're absorbed gradually and they enter the brain slowly and leave the brain slowly, there is no evidence of addiction from that. Now, if you overuse the medicine, you could become dependent on it a little bit. I'm thinking of, for instance, Kitty Dukakis, when Michael Dukakis ran for president, probably before your time. But, they were on so many campaign stops that she began to take stimulants to try to keep up. As have many other, celebrities and professionals. The dancer, the famous dancer Bob Fosse on Broadway was a stimulant-dependent individual. That's a little different. That's where you're relying on the drug, like a truck driver trying to drive 24 hours without sleep. You're relying on the drug to do something because you are abusing yourself, you're not getting adequate sleep, and you need the drug to keep you awake. That's a dependency. That's not a biological addiction. And so could that happen? Sure, but it's very rare. the vast majority of people with ADHD are at no risk of addiction with these drugs if they are taken the way we prescribe them. And I wish people would make that clear. But of course, it's to the advantage of critics and extreme religious groups and political groups or even newspapers not to make people aware of these distinctions that I'm talking about, that the route by which you administer the drug determines the addictiveness, and that if you take it the way we prescribe it, it isn't. Well, they don't want to do that. They want to obviously tar these drugs with a broad brush of abuse, and so you get this misunderstanding in the public that you've mentioned, which is very real, but is not true. And that's why we tell people, you have nothing to fear from these medications. They are the safest drugs prescribed in psychiatry, far safer than antidepressants, anti-anxiety drugs, and especially antipsychotics that we have to use. So you don't have to worry about that as long as you don't start down the path of abuse like some people do, which is where you do crush it and you do try to snort it or inhale it. But what we found is the people most likely to do that are people abusing other drugs too, not just the stimulants. So being ADHD is not the issue there. It's really having a drug use disorder already and finding yet another drug that you can creatively abuse yourself with. But barring that, which is incredibly rare, by the way, these drugs are very, very safe. Now, I want people to understand that like insulin for the diabetic, these drugs only work the day you take them. And if you stop taking them, you will go back to your baseline again. All advantage is lost. So that's why I often refer to ADHD as the diabetes of psychiatry, because the treatment models are exactly the same. You have to treat this on a daily basis for a long period of time in order to prevent all these harms from occurring that will occur if you don't take your medication and participate in therapies. We don't like to prescribe medication entirely by itself. So, my point then is that if you view it correctly, it is like insulin, and you need to take it. And don't expect like an antibiotic. It's going to cure you of something, and then you don't have to take it anymore. Now, you may not need it every place in your life, and you may not need it over longer periods of time. The answer to that is, as long as you're impaired significantly, then we think you should be taking it, and you certainly should be taking it while you're driving. But we also like to couple medication with 4 other interventions. So I like to talk about the 5 components of a treatment package. If it's all right, I'll go through them very quickly with you, Peter. Okay, thank you very much. Number 1 is appropriate evaluation and diagnosis by somebody who knows what they're doing. Not your average family practitioner, not some GP, or in the case of families, just your pediatrician. Those are good people for screening that you might have it, but they're not going to be the people who really should be managing you day in and day out, unless, of course, you live in a rural area where there are no mental health professionals readily available. But that said, a proper evaluation, and the reason for that is that 85% of people with ADHD have a second disorder. 55% have a third disorder. So we need to look at the entire aspect of the patient's life and not just narrowly at the ADHD complaints that they may have, because there are other risks here that we've already talked about: anxiety, depression, substance abuse, even antisocial behavior, oppositionality, and so on, are all linked with this disorder, not to mention the medical disorders that I'd already mentioned. So we really want to do a thorough evaluation and make sure that we understand the person's presenting problems completely. The second thing is education, and I don't mean going to school. I mean, get yourself educated. As David Lindsay, the novelist, wrote, truth is an assembled thing. Read widely, visit different websites, ask people about the most credible, because if you just Google ADHD, you're going to get 5 to 10 million hits. There's only really 10 to 15 good sites out there. The rest is either advertising or shilling for a product, or part of the critics of ADHD, like the Scientologists, that are trying to lure you in and mislead you. So, you want to look at chad.org and add.org, and in Canada, cadra.org, and start with these, or .ca, I think it is. And then you can expand out from there. There are other good websites too, such as many of the professional guilds like the American Psychiatric Association, or especially the Child and Adolescent Society for Child Psychiatry, are all very good places to go and get information. You can come to my website. There's a lot of free fact sheets on there. But please read widely, because the truth will fall out because it will be repeated across multiple sources. Don't just believe in one individual. So make yourself an expert, just as if you had diabetes. You need to know your disorder. And then, as Adam Levine said beautifully in one of his YouTube videos, own it. It's part of you. It's part of your personality. It's part of who you are. You don't have to be ashamed of it. I mean, I'm not ashamed. I'm bald. I'm colorblind. I'm not very coordinated. I'm developing a left facial asymmetry here. Own it. So what? It's part of life. And then once you own it, you can move on and either compensate for it or deal with it. So that's number 2. Number 3 is the medication. About 80% of adults will need the medication, bar none. It's the most effective thing we have. And I'm a psychologist, and I'm telling you that. Nothing else we have comes close to what these medications can do for people. Now, that said, we want to couple that with what we call accommodations, changing the environment around you to compensate for your disorder. Just like if you're in a wheelchair, we can put a ramp into a building that allows you to enter it, and you're not impaired at entering buildings anymore, even though we didn't change your disorder at all. Well, ADHD adults can do the same thing by changing their environment, their workspace, their workflow. Maybe having 2 computers, one for gaming, and that's in another part of the house, and just this one right here for working. That's an accommodation where you're not putting things that lure you away, and maybe downloading some of these internet site blockers that you can put in there to keep you from surfing and hitting social media and looking at that little email ping that came in on your screen. There are ways to reorganize workspace, workflow, your life, and even your health in order to improve the impact of ADHD and that it's having on your life. So accommodations are very, very important for people. And you can get those through looking at books like, my book, Taking Charge of Adult ADHD, many books by Ari Tuckman, Tom Brown, Craig Sermon. There's a lot of good writers out there that have, their books are chock full of good advice about these kinds of accommodations. I'll just give you one. A lot of people think that we can solve the time management deficit by, using high tech. So, okay, let's put it in Outlook and let's create a Google Calendar and what we've learned in our practice is that doesn't work very well. You're better off having a paper week at a glance calendar, which is always in your visual field. And that you make entries as you go, because the problem with the other calendars is you have to charge them up. You got to know where your power cord is. Maybe you can't even find the damn device because it slid out of your pocket and went under the seat of your car. And on top of that, somebody has to upload your schedule for this week on Sunday into that calendar. And it's not going to be the person with ADHD that's organized enough to do this. So these are all of the things that we find interfering with technology being the be-all and end-all of saving adults with ADHD. It isn't. We have yet to find anything in technology that's been all that great. There's certainly none of the apps out there. And Peter, there's 300 apps that claim to help people with ADHD. Not a one of them has any research basis to it. Not one, right? So, don't go over to those things either. And you certainly don't need to be playing games like on Lumosity and, CogMed and all these other sites that are going to train your brain and so on. You're going to have a good time and you're going to play the game and you're going to get better at the game. And that's it. And there's nothing is going to change in your life. So accommodations are very important. And you can get that through things like ADHD coaching as well. And then finally, there is modification, behavior modification, which is working on trying to teach yourself and train yourself different ways of doing things. And for adults would be through what we call cognitive behavioral therapy for these executive deficits. Not traditional CBT for anxiety and depression. That works a little differently. but it's a cognitive therapy intervention, but it works expressly on the time problems, the emotion problems, the motivation problems, and the inhibition problems. So books by Mary Solanto and by Russ Ramsey are books that contain the kinds of things that we have found in research to be very helpful for young adults or adults with ADHD. So notice we've got evaluation, education, medication, accommodation, modification. You put those 5 things together, you're going to have a darn good treatment package for dealing with your ADHD and succeeding in spite of it.
So I'm going to link your website and your book in the description, so people could check that out. On a personal note, I just wonder how you kind of stay positive and optimistic, because I dabbled into ADHD research on a surface level, and then knowing we had this call, I dove in very deeply, and I was kind of shocked with the success of documentaries, books, articles, YouTube videos that are viral, that are spreading some really now seemingly dangerous misinformation about a very, very serious thing. So, just on a personal note, how do you stay positive? How do you stay optimistic? Because the moment I emailed you, said, "Hey, you want to talk about ADHD on my podcast?" You said, "I'm in," and you've been shouting from the rooftops. So how does it feel to be that guy that's really caring about a lot of people out there when it seems like the internet's been very harsh?
Well, it feels very good because a large part of the meaning of my life is reaching out to others and disseminating the science-based information to try to contradict the nonsense and the mythology that goes on around this and other disorders as well. And very early in my career, some of my role models in science were those who left the ivory tower to disseminate science to the masses. And they were people like, Carl Sagan in astrophysics, and also Richard Dawkins in the field of evolution and biology. And then, of course, earlier we had Jacob Bronowski, who was one of my idols, because he did the Ascent of Man series back in the 70s. And, this is a polymath, it's a genius. And yet he would go on public TV like Richard Attenborough does and promote awareness of evolution and science and what we're learning. And, just great people like that. Edwin Wilson at Harvard, who studies ants and insects, but goes out and tries to popularize what we're learning. And so, these are people who I aspire to be, because unlike their colleagues, and often to the detriment of their reputation with their colleagues, they would leave the office and go lecture to a parent group, do a podcast like this, take every opportunity presented to themselves to share that information. Here's what I teach my students. You can publish an article and feel really good about that. Less than 20 people are going to read the abstract or the full article you just published in that journal. That's it, okay? And certainly most of them, if not all of them, are not going to be the people who needed to read it, which is our patients, our families. On the other hand, if you publish a trade book like I have, or you give a lecture, or you get one of your lectures put on YouTube, and I've got several, I didn't put them there. The conferences I spoke at put them there. I get 5 emails a day from just one of my YouTube videos of people saying, "I cried when I saw your presentation. You're the first person that gets this disorder." I mean, that just warms my heart, because, it means that the science is getting out there to the people who are most in need of it. So I encourage my students to always leave the office and take every advantage given to you to disseminate what we know. And don't worry about what your colleagues down the hall are tut-tutting about. "Oh, I can't believe you stooped, to do a trade book of all things," when the rest of us are doing scholarship and publishing journal articles, which, as I've said, is pretty much a waste of time other than getting, promoted in tenure.
I found your lecture off of YouTube. It has over 1 million views. It's very accessible for everybody. So taking advantage of new media, I'm glad you're down to do, young people's podcasts and spread the word. I've never had I don't think I've had an issue with ADHD in my life, but I was very fascinated with some people in my life to better understand what they're going through. And as I did some research, I felt very uncomfortable with the information that's been put out. And I'm glad that hopefully this conversation helps some people. But I wanted to ask you one final question wrapping up. I'm somewhat a nerd when I read about AI, the future of healthcare, gene editing. I've been reading a book about. Wrapping up on a positive note, is there anything coming up that makes you excited about the future for a real deal 20-year cure, whether it's gene editing or a medication that's in the works? Do you believe in 20 years we're going to have a real deal cure?
I'm not sure that we'll be at the point of cure. We might be. I was hoping we'd be there by now, but of course, I got a little overly optimistic about that 20 years ago when we first started really looking closely at the genetics of ADHD. I think on the horizon, in the near term, first of all, we're going to have better diagnosis because we're going to have better instruments, such as the way we apply AI to neuroimaging. Because the neuroimages that we see in the ADHD brain are very disrupted, but they're subtle. And it's going to take very sophisticated, I think, technology to be able to tease that out to the point where it's reliable and valid enough to use for diagnosis. We don't have that right now. Don't go get brain imaging or SPECT scanning or anything that people may offer you that's just not useful. And it's the same with genetic testing. There are sites right now that will gladly do genetic testing and tell you if you have ADHD genes. Those are not reliable. We just don't know enough about the genetics of ADHD to say that, here are the 3, 4, or 5 genes. At this point, it looks like it's going to be anywhere from 25 to 45 different gene sites in the DNA. But the hope, down the road is that perhaps within the next decade, with all the research, because genetics is the fastest moving area of research right now for us, we may have genetic testing. We may be able to subtype people based on the different genetic architecture that they have. We may be able to predict drug responding, which we cannot do right now, even though some people think we can. We cannot do that right now. So, improved diagnosis, improved prediction about drug responding, maybe even improved drugs for ADHD. Once we know these genes and we know what they do in the brain, it might suggest a different kind of medication for some types of ADHD. We're learning that GABA, for instance, is another aspect involved in ADHD, unlike dopamine and norepinephrine that the traditional drugs are affecting. So, can we find some kind of medication that works on the GABA system? And there'll be more like that as well. I'm just sort of simplifying it. So those are near-term goals. And then, of course, with CRISPR and the other gene editing technologies that we have, once we've lined up the suite of genes that we think is contributing to risk for ADHD, then it might be possible to take, egg and sperm that may contain some of these genes that we've identified and re-edit them to remove them. But here again, we want to be a little careful about that because, we don't want to be trying to genetically engineer the perfect individual. Even though some parents would like to do that. A lot of the things that have contributed to our culture come from people who are not neurotypical. So we don't want to get down to this very homogenized human where we're doing CRISPR technology to edit out genes that create this wonderful variation in human personality and human thinking that these genes are contributing to. But I think in the meantime, better drugs, better diagnosis, will be something I think that we can look forward to.
So that was a hopeful and brighter conclusion. I know I've been kind of somber this episode, just trying to get to some truth for ADHD, but I really thank you. You are very compassionate. You care about people, and you do it from a science-based, real deal. You have what 300 over 300 academic papers or 300 lectures.
Yeah, papers, book chapters, indeed, 27 books and so on. But the most important ones to me are the ones, like the YouTube video that a lot of people see, or I was in Scientific American back about 20 years ago, and it went out to, I think, over 30 different countries and languages. Just this simple little article explaining ADHD to people. Those are the things I treasure most because I think they have the greatest impact on people. And if I'm passionate and involved, it's not just that I care, about, our patients, our clients, our families. But it's been in my family. I grew up with a brother with ADHD. I lost him at 56 due to his ADHD, interfering with his driving and causing a car accident. I lost a nephew to suicide because of his grossly impulsive behavior when he was a young man, and within 15 minutes of a fight with a girlfriend, had hung
Wow.
himself. And so it's impacted my life in a very personal way, and that's why I'm so adamant about making sure that people really understand the risks of the disorder and that it is highly amenable to
Well, I
treatment.
thank you for your time, and I really think someone listening to this is gonna feel the stigma lifted and maybe go see a doctor for an examination or just feel more comfortable taking the medication they already have. To celebrate the new podcast, I'm giving away a PlayStation 5 to one of my viewers. All you have to do is like and subscribe. That's it. Full details in the comments. Good luck.